colleague, Nate Epp. Over the next hour and a half or so, we're going to focus on talking about Social Security and Medicare. Once again, my name is Michael Hermes. I'm a financial advisor at HORAN. For over 70 years, HORAN has created plans to control healthcare costs, protect your wealth, and ensure your life. And today's webinar, once again, will give you all the information you need to navigate both Social Security and Medicare. We will be taking questions after today, so feel free to stick around at the end if you have any specific questions. Also, both Nate and my contact information is in the webinar as well, so feel free to call us or message us directly if you have any personal questions. We're always happy to help out with that. We will also be sending a copy of the presentation as well after this. And so feel free to take notes and come back to us once again with any questions you may have. So for the first 45 minutes, we'll be spending time on Social Security, and the next 45 minutes, my colleague Nate Epp will come on and talk about Medicare and everything you need to know there. So with that, we're going to jump right into it. Once again, my name is Michael Hermes. I'm a chartered financial analyst and certified financial planner. Really, my specialty is anything retirement planning related, whether that be investment management or Social Security planning. Happy to help any way that we can at HORAN. We do not charge for any sort of initial consultation or anything along those lines. But today, some of the topics we'll be covering in regards to Social Security is, will Social Security be there for you? So you hear a lot about how the system's going broke, and so we will kind of debunk that myth a little bit, how much you can expect to receive from your Social Security benefit, when you should apply for your Social Security, and different strategies you can use to maximize those benefits. If you ever contributed to a non-covered pension, in Ohio, the two most common ones are STRS and OPERS, the Public Employee Retirement System and the State Teacher Retirement System, how that can negatively impact some of the strategies we'll talk about today, how your benefits are taxed, how you actually apply for your Social Security, and lastly, how it all fits into your retirement picture. So the first question, will Social Security be there for you? So every single year, Social Security releases their fiscal results. Actually, just yesterday, Social Security came out with their 2019 fiscal results, and they look awfully similar to what happened in 2018. But the results you are seeing on this slide do represent 2018's results. And so every single year, about $1.003 trillion comes into the Social Security system via taxes on your paycheck. And then every single year, about $1 trillion leaves the system in the form of benefit payments. So actually, at the end of 2018, there was a surplus, so more money coming in than going out, of about $3.1 billion. Any surplus that's generated each year goes into the Social Security Trust Fund. And as of 9/30/2018, and once again, the new results came out, it's quite similar. The trust fund currently sits at about $2.9 trillion. So that trust fund sits there earning interest, ready to be paid out to beneficiaries in case there's no more surplus. So it was projected that 2019 there wasn't going to be a surplus anymore, and they were going to have to start dipping into that trust fund every year to continue paying beneficiaries 100% of their retirement benefit. The results came in that 2019 there was still a surplus of about $2.5 billion, so they're not having to dip into that trust fund balance yet. However, I would imagine 2020, that's when there will be no more surplus. And so going forward, every single year, they're going to have to start dipping into that trust fund to continue paying everyone 100% of their benefit payment. And so it's projected that by the year 2035, that trust fund is completely depleted, and Social Security can only pay out as much as they take in benefits every year. And so come 2035, everyone is expected to get roughly 80% of their Social Security benefit amount. So when we're doing retirement forecasting, we like to take this into consideration. Okay, so everyone will still get their benefit, It's just going to be 80% instead of the original 100%. So that is without any sort of reform, the way it stands today. Currently in Congress, the beginning of 2019, I believe, there was a bill introduced called the Social Security 2100 Act. What this states, if this gets passed, everyone will get 100% of their Social Security benefit through the year 2100. And so how are they going to fix that shortfall in the Social Security system? Twofold, really. So the first way they're going to fix it is currently the first $137,700 of your income is subject to Social Security tax. So what they're going to do is increase that wage base that's subject to tax. So if you make over $400,000, Social Security tax will kick back in. So that's the first way that they're going to do that. The second way they're going to fill that gap is by gradually raising the Social Security tax over the next 25 years. So currently both you and your pay 6.2% Social Security tax on that wage base. And so what they're going to do is raise it another percent for both you and your employer to 7.2% each over the next 25 years. So really it's twofold. They're going to increase the amount that's subject to tax and increase the overall tax rates, and that's how they're going to fix the Social Security system. Whether or not that actually goes through, I think there's some other areas of possible reform, which I'll make a comment about later in the presentation. But as it stands right now, that's how they're going to fix the system. And so keep your eyes out on the news for the Social Security 2100 Act. So how much can you expect to receive? So hopefully everyone here has at least taken a glance at their Social Security statement. And if you have, you'll know in the top right-hand corner of the first page of your statement when you receive it, there's a big bold number. And that number is the amount you are eligible to receive from Social Security at your full retirement age, which we'll talk about in a second. But how are they coming up with your Social Security benefit amount? The national average Social Security benefit is around $1,400 a month. And so the way that they're coming up with your benefit is they're taking the highest 35 years of your earnings history, plugging it into a formula, and outspits your benefit amount. Okay, so the highest 35 years is the key here. So if you are receiving your statement and you open it up to page 3, it will list every single year you had earnings subject to both Social Security and Medicare. Okay, so go through that and double check your earnings history and make sure it looks accurate. Make sure you have income in there for every year you in fact did contribute to Social Security. If you have any zeros in there for years you in fact did contribute to Social Security, those will have a negative impact on your benefit amount because they're using the highest 35 years. So go through, double check, make sure your earnings history looks accurate, make sure you don't have any zeros in there for years you did work. Typically, if you do have a zero in there, it was for a year you were self-employed. So the Social Security Administration says they're about 99% accurate with their reporting history, which means they can mess up 1% of the time, and typically it happens to people who are self-employed. So go through, double check your earnings history, make sure it looks accurate. If you're going through that page and you count 34 years of earnings and you're contemplating working one more year to hit that 35th year for your Social Security benefit, based off of the way they come up with the formula and the benefit amount, I promise you it is not worth it to continue working to hit that 35th year for Social Security. In order to break even on the money you put into the system versus what you'll get back out, typically you have to live to be roughly age 160. Okay, so it's really not worth it. But they're using the highest 35 years of your earnings history. And so if you, like many others, have never taken a look at your Social Security statement or you're unsure of where to get it, they will send you a statement in the mail every single year when you turn 60. Before then, they're supposed to be sending you a statement every 5 years. And so if you've never gotten your statement, like most people, I would encourage you to go on to socialsecurity.gov and sign up and create a Social Security account. and log in and double check your statement, double check your earnings history, make sure it looks accurate. But once you sign up for your Social Security account online, they will stop mailing you paper copies of your Social Security statement. Okay, so I would encourage everyone here today listening to create a Social Security account. All right, when should you apply for your Social Security benefits? So as I alluded to before, when you get your Social Security statement, in the top right-hand corner, there's a big bold number. And that number is the amount you're eligible to receive at your full retirement age. And so your full retirement age is when you can collect 100% of your Social Security retirement benefit. Okay, and your full retirement age is based off of the year you were born. So if you were born between 1943 and 1954, your full retirement age is 66. If you were born after that, they kind of stagger the full retirement age every 2 months going forward. And then if you were born 1960 or later, your full retirement age is 67. Fun fact, when Social Security was first started, actually, the full retirement age was 65. Most to be 65, though, when Social Security was first started. Nowadays, you could see the latest full retirement age was 67, but most people live to be in their early 80s now. So benefits are being paid out a lot longer than they used to be. So I wouldn't be surprised if in some sort of reform in the future, they start to continue extending out that full retirement age table. Many people know this, but the earliest you can begin taking Social Security is age 62. You don't have to wait until your full retirement age to begin collecting your Social Security benefit. But for each year you take it early, it's going to be discounted roughly 7% per year you take it early. Okay, so if you look at that middle column, if your full retirement age is 66 and you start your Social Security benefit at 62, instead of getting the full 100%, you will get 75% of your benefit amount. And once you've taken your Social Security benefit, you've taken it. That's the amount you're going to collect the rest of your life. On the opposite end, each year you delay taking your Social Security benefit, okay, not continuing to work, just delaying taking your benefit will increase 8% per year until age 70. So if your full retirement age is 66 and you wait until age 70, you will get roughly 132% of your benefit amount. We had a physician client of ours one time. He was age 72. He said, "Mike, when should I start taking my Social Security benefit?" And we told him, well, you should have started taking it 2 years ago when you turned 70, because there's no more delayed retirement credits past age 70. And so when he called up the Social Security office, the most that they would lump sum him back was 6 months worth of missed payments. So he missed out on a 1.5 years worth of Social Security checks. So point being, never wait past age 70 to begin collecting your Social Security benefit. Both your age 62 amount, your age 70 amount, and your full retirement age amount are on page 2 of your Social Security statement when you receive it. If you read the fine print closely, though, the amount that they show you at age 70 and your full retirement age and 62 assumes you continue to work and earn what you made last calendar year. So if you're planning on retiring at 66 and you're looking at your age 70 amount, the amount that you'll actually get from Social Security will be a little bit lower than what's stated on your statement. All right, so when should you start taking your Social Security? 62, your full retirement age, 70, or sometime in between? If you ask 100 different financial advisors, you'll get roughly 100 different answers. And so everyone's situation is different. Same goes with Medicare. So just because your friend did one thing doesn't mean that's necessarily what's best for you. Okay, so here are some things to consider. Your health status. If you don't think you're going to live very long, you'll probably want to go ahead maybe and start up your Social Security benefit. Get as much out of the system as you can while you're still living. Another, on the opposite end, life expectancy. So if you do think you're going to live a long time and your family has good health history, good longevity, it might make sense for you to wait until age 70 to begin collecting. So for example, if you wait until age 70 versus taking Social Security at your full retirement age, call it 66, you're missing 4 years worth of checks by waiting to delay taking your benefit. And so the break even on that is roughly age 81, 82. So if you think you're going to live longer than 81 or 82, it would have been beneficial for you to wait until age 70 to begin collecting. The third bullet point, need for income. So if you're getting ready to retire and you don't have any other sources of income, you need some money to live off of, right? So you'll probably have to go ahead and start up your Social Security benefit. Whether or not you plan to work. This is a big one, and we see a lot of people mess this up all the time. So in Social Security, there is something called the annual earnings test. What this says is if you start your Social Security before your full retirement age and you continue to work, you cannot make more than $18,240 per year, or Social Security is going to withhold a portion of your benefit amount. Okay, so typically what we see happen is you're 62, you retire, you start up your Social Security benefit, so you're only getting 75% of your Social Security amount, and then 6 months goes by and you're bored, so you pick up some part-time consulting work or some just a part-time job, and you end up making more than $18,240 a year, and all of a sudden your Social Security check stops coming, and you're wondering what happened. It's because you hit this earnings test limit. And so once again, the way this works is if you are still working and you begin collecting Social Security before your full retirement age, you cannot make more than $18,240 per year, or Social Security will withhold a portion of your benefit amount. The year you reach your full retirement age, so January 1 of the year you turn, say, 66, that earnings test threshold increases. You can now make up to $48,600 per year, or $4,050 per month, before Social Security will begin withholding a portion of your benefit amount. And then the month you hit your full retirement age, so for me, November 1st of the year I turned 67, there is no more earnings test. I can make $1 million per year and collect my full Social Security benefit. Because the earnings test goes away at your full retirement age, we usually encourage people to wait until at least your full retirement age to begin collecting. If you do mess up and say you started Social Security early and you went back to work and they withheld a portion of your benefit amount, you don't lose that benefit forever. I believe what they do is they'll prorate a portion of the amount that they withheld back into your Social Security check beginning at your full retirement age. So you'll get an extra, call it $20 more per month on your Social Security benefit. That $18,240 per year number, that only includes earned income. So money you make from wages from your employer or self-employment income. It does not include money from your investment accounts, any money you've taken out of IRAs or 401ks, money you're receiving from pension plans or stock options, or any rent income. Okay, it's only earned income. So if you take nothing else away from the slide, just remember, at full retirement age, there's no more earnings test. You can make as much money as you want and collect your full Social Security benefit. All right, so this is usually the part of the presentation when I get to it. Most people say, no wonder the system's going broke, because there's ways you can collect a Social Security benefit even if you never contributed into the system. So we like to say the Social Security Administration, they're kind of like drive-through employees, right? You go in, you tell them what you want, and hopefully they'll give you what you ask for. They're strictly order takers. They're not meant to be advisors and help you figure out what strategy is best for your situation. So you want to go in ahead of time knowing what your benefit amount should be, so there's no confusion. So we're going to talk about some of the strategies that you can still utilize today to hopefully get a higher benefit amount. The first strategy we're going to talk about is the spousal benefit. So when you apply for Social Security, you can get the greater of your benefit or 50% of your spouse's benefit. Once again, you can get the greater of your benefit or 50% of your spouse's benefit. You can't get both, all right? And so let's take a look at the example, and hopefully this will make a little bit more sense. So Jane's PIA stands for Primary Insurance Amount. It is Social Security's fancy way of saying the amount you are eligible to receive at your full retirement age. So Jane's eligible for $2,000 a month off of her retirement record from Social Security. Mike's eligible for $800 a month off of his record. Instead of Mike taking his retirement benefit, he's going to apply for his spousal benefit and collect half of Jane's $2,000 and get $1,000 a month instead of $800. Okay, the greater of your benefit or 50% of your spouse's. A few things about this. Mike's benefit could be zero. He could have been a stay-at-home parent his entire career. He is still eligible to collect half of Jane's $2,000 and get $1,000 a month. This does not negatively impact Jane's benefit in any way. She will still get her full $2,000. The only difference is Mike is getting a higher benefit amount. The earliest that you can file for a spousal benefit is age 62. But once again, each year you take it early, it's going to be discounted roughly 7% per year. So in order to get the full 50%, you have to wait until your full retirement age to apply. Okay? On the opposite end, there are no delayed retirement credits. So by that, what I mean is your benefit, your spousal benefit, will not go up 8% per year past your full retirement age. And so never wait past your full retirement age, typically, to file for a spousal benefit. That annual earnings test that we talked about as well, this applies to all of these strategies going forward. So if Mike is still working and he's 62 and he wanted to start up his spousal benefit, he cannot make more than $18,240 per year, or Social Security will withhold a portion of that spousal benefit. With this strategy, it is important to know that Jane must be collecting her Social Security retirement benefit in order for Mike to take a spousal benefit. There used to be a strategy called file and suspend, where Jane could have filed for her benefit without actually taking the $2,000, allowing Mike to take the spousal benefit. However, you can no longer do that anymore if you have not already done that. So going forward, Jane has to be collecting her retirement benefit in order for Mike to take a spousal benefit. There's also an important rule to know. It's called deemed filing. So with the change in file and suspend rules with Social Security, there's something called deemed filing. And what that says is if you are eligible for any of these strategies, you are filing for all of them at the same time, meaning you cannot separate your spousal benefit from your retirement benefit and pick and choose which one you want. There's one exception to this rule going forward, and we'll talk about that later. But essentially, the way it works now is if you file for a retirement benefit and you are also eligible for a spousal benefit, you are going to get the greater of the two automatically. You cannot separate them so that they work independently from each other. If you take away nothing else from the slide, just know you can get the greater of your benefit or 50% of your spouse's benefit. All right, divorce spouse benefits. So if you were married for at least 10 consecutive years and you are divorced, you can get the greater of your benefit or 50% of your ex-spouse's benefit. The same rules as last time, except with one key difference. Before, I said Jane had to be collecting in order for Mike to take the spousal benefit. As long as your ex-spouse is at least age 62 and you were divorced for at least 2 years, you do not have to wait for your ex-spouse to begin taking their retirement benefit in order for you to take the divorced spouse benefit. You can just start up your divorced spouse benefit. All the same rules still apply, though. 62 is the earliest you can take it, but for each year you take it early, it's going to be discounted. There's no delayed retirement credits past your full retirement age, and that earnings test still applies. A couple tacky things about divorce spouse benefits. I could have been married 3 times, for example. I could have 3 ex-spouses collecting off my Social Security record. I don't know what's happening. It doesn't negatively impact my benefit in any way. But theoretically, I could have 3 ex-spouses collecting off my record. Or vice versa, if I wanted to collect off one of my ex-spouses, I can't collect all three at once. I can only get 50% of the highest benefit. If you remarry, it's important to note, if you remarry, you do lose the ability to collect an ex-spousal benefit. If you are going to take a spousal benefit off of your ex-spouse's record and they remarry, that does not matter. It only matters if you remarry. Survivor benefits. So if your spouse passes away, you are eligible to collect the greater of your benefit or 100% of your deceased spouse's benefit. So once again, you don't get both. You can get the greater of your benefit or 100% of your deceased spouse's benefit. So in that example there, Chris and Julie are married, both full retirement age. Chris's benefit's $2,000 a month, and Julie's eligible for $1,200. Chris passes. Julie notifies Social Security. That's important. They're not going to come to you and let you know you're eligible for a higher benefit amount. You go to them, and her $1,200 benefit is replaced by her 100% survivor benefit. So she's going to get Chris's full $2,000 a month instead of her $1,200. A couple things to note about survivor benefits. In order to collect a survivor benefit, you must have been married at least 9 months. The earliest you can take a survivor benefit is age 60, not 62. But the same rules still apply with that earnings test. And each year you take it early instead of waiting until your full retirement age, it will be discounted roughly 7% per year. If you are married for at least 10 consecutive years, you can get the greater of your benefit or 100% of your deceased ex-spouse's benefit. And so if you remarry after age 60, you still have the ability to collect the survivor benefit off of your deceased ex-spouse. If you remarry before age 60, you lose the ability to collect that survivor benefit. And so one time we actually had a client who was 59 and a half. Without knowing this rule, they ended up remarrying, lost the ability to collect a survivor benefit off of their deceased ex-spouse. And so our recommendation to them was to temporarily get divorced for 6 months, wait until they turn age 60, file for their survivor benefit off their deceased spouse's ex-spouse's record, and then get remarried to her current spouse. And so technically, in the eyes of Social Security, that would have worked. But if you're wondering, she didn't actually end up doing it. One strategy that we'll often see couples use with a survivor benefit is a spouse with the higher PIA, the higher retirement Social Security benefit, will let theirs grow until age 70. So that way, if they were to pass away, the surviving spouse can collect 100% of that increased benefit amount. So it acts as some additional insurance, essentially. All right, dependent benefits. So we have a client at HORAN who is his full retirement age and began collecting Social Security, and he is about to welcome his 7th child into the universe. And so his child is eligible to collect 50% of his Social Security benefit through age 18 as long as he stays enrolled in high school, or 75% of his benefit amount if he were to pass away. So typically what we see happen is you might have legally adopted a child or a grandchild. This still counts. You can still do this. And so we'll take a look at the example there. Chris and Julie are married, both full retirement age, except now they have a child, Johnny, who's 15. Chris's benefit's $2,000 a month, and Julie's benefit is $1,200. Chris passes, Julie notifies Social Security, and her $1,200 benefit is replaced by her 100% survivor benefit, just like last time, except now Johnny can also collect $1,500 a month, so 75% of Chris's benefit amount through age 18, as long as he's enrolled in high school. So if Chris was collecting his benefit before he passed away, Johnny would have been eligible to collect 50% of that benefit amount. All right, restricted application. So this is the last complicated strategy that's left in Social Security. And if you are eligible to do this, I would strongly encourage you to do this. I have seen this strategy make the difference of roughly $100,000 to $130,000 over the course of someone's life. Okay, so essentially the way this works is before, when I told you that rule about deemed filing, where you can't separate your spousal benefit from your retirement benefit when you file for Social Security, this will allow you to separate the two so that they work independently from each other. Okay, and so in order to do this, like I said, this is getting phased out of Social Security. You or your spouse must have been born on or before January 1st of 1954 in order to qualify for this strategy. Once again, that date is on or before January 1st of 1954. So in this example, Mike and Jane are both 66. Mike's eligible to collect $2,000 a month off of his retirement benefit, and Jane's eligible to collect $800 a month off of hers. Instead of Mike taking his retirement benefit, Jane is going to begin collecting her retirement benefit of $800 a month. Mike, who was born on or before January 1st of 54, is going to restrict his Social Security application to just his spousal benefit. He's telling Social Security that he doesn't want to touch his retirement benefit. He only wants to collect his spousal benefit and collect 50% of Jane's retirement benefit. And so Mike is eligible now to collect $400 a month. In the meantime, Mike's retirement benefit, because he restricted his Social Security application, is going to continue to increase 8% per year until age 70. So by the time he turns age 70, his benefit will have increased from $2,000 a month to $2,640 per month. And so at age 70, he's going to flip from his spousal benefit onto his increased retirement benefit. And now that he's collecting his retirement benefit of $2,640, Jane can flip from her retirement benefit to her increased spousal benefit and collect half of Mike's PIA and get $1,000 a month. So there's a lot of flip-flopping and switching going on here, but essentially the way this works is Mike is getting a free spousal benefit from his full retirement age until age 70, and at age 70, he's going to get that increased retirement benefit amount. That's pretty much all that's happening here. If you have questions about restricted application and you're eligible for the strategy, or someone you know, feel free to pass along our contact information. We're always happy to help, let you know exactly what you need to be doing and when you need to be doing it. All right, this brings us, so that's all the strategies that are left with Social Security. We're going to talk about now how some of those strategies, you might not be eligible for them if instead of contributing to Social Security, you are working and contributed to a non-covered pension. And by non-covered pension, I mean something other than Social Security. So once again, the most common ones in Ohio are STRS or OPERS, or if you were contributing to a 401A. And so what these qualify under is the windfall elimination provision and government pension offset provisions of Social Security. Okay, like I said before, essentially what Social Security says is because you were contributing to some other pension instead of Social Security, a lot of those strategies we talked about are null and void, and you do not qualify. And so we'll tell you now, we'll go through and let you know how you might be impacted if you did in fact contribute to a non-covered pension. If you were contributing to a private employer's pension, such as, for example, Johnson & Johnson or something along those lines, this does not impact you because you were also contributing to Social Security at the same time. So the first provision is the windfall elimination provision. What this talks about is if you have Social Security benefits, say you worked in Social Security for 10 years and then you switch careers, and now you also, in the next 30 years, you worked as a state teacher and have STRS. With the windfall elimination provision, this applies to people who have both a Social Security benefit off of their record and a non-covered pension benefit. And so Social Security will reduce the portion that you get from your Social Security benefit amount depending on the number of years you contributed to Social Security. And so the way this works is when you open up your Social Security statement to page 3, you need to count how many years you contributed to Social Security. If you contributed to Social Security for more than 30 years, there is no windfall on your benefit. So you will get your full Social Security and your full pension. If you contributed for less than 20 years, the most that Social Security can withhold from your benefit amount is about $463. And these do increase every single year slightly. But the most that they can withhold is $463. And this isn't shown on your statement anywhere. You find out about this once you applied for your benefit. So if you count up your earnings and you have less than 20 years and you look at your Social Security statement and it says you're eligible for $1,400 a month, you have to subtract roughly $463 from that amount, and that's how much you will receive from Social Security. Okay? This is the quick way of figuring that out. With Social Security and windfall, you'll always get something. It will never reduce your benefit to zero. You'll always get something from Social Security. Okay? If you have questions about calculating the windfall, let us know. We're happy to help you figure out what the exact windfall that you'll experience will be. The second provision is called government pension offset. And so this applies to people who might not have Social Security. They have a non-covered pension, and they want to try and collect a spousal benefit or a survivor benefit off someone else's record, not their own. What Social Security Administration says is because you have this non-covered pension, you might not be eligible for a spousal or survivor benefit. And so what they're going to do, the way they're going to determine how much to withhold from your Social Security benefit is by taking 2/3 of your pension amount and subtracting it from whatever you would have received from Social Security. Once again, this only applies to people trying to claim a spousal or a survivor benefit. It does not apply to people collecting off of their own record. That is the windfall provision. So in this example, John and Jane are married. Jane has a pension benefit of $3,000 per month. John has a Social Security benefit of $2,000 per month. John passes, and Jane's going to try and apply for her survivor benefit off John's record and collect 100% of his Social Security benefit. Because she has this non-covered pension, the Social Security Administration is going to say, hold up, you're subject to government pension offset, and we're going to take 2/3 of your pension amount, so 2/3 of $3,000 is $2,000, and subtract it from whatever she would have received from her survivor benefit. In this case, $2,000. So 2,000 minus 2,000 is 0. So unfortunately, in this case, Jane won't get any sort of survivor benefit. She will only get her pension. And so if you are subject to government pension offset, that strategy I talked about with a survivor benefit where one spouse might wait until age 70 to begin collecting. So if that way they pass away, the surviving spouse is eligible for the higher benefit amount. If you're subject to government pension offset, that strategy probably does not make too much sense in your case. So these two provisions are some of the most complicated provisions in Social Security. So everyone's situation in this is different. It really comes down to the exact numbers of what you should be doing. So once again, if you have questions on government pension offset or windfall, please let us know. So we're getting to the end here, only a couple more sections. We're going to talk about taxes on your Social Security benefit. I get this question a lot. And so you paid Social Security tax your whole life, and now you're about to start receiving your Social Security benefit, only to find out that once you receive it, it's also taxed. And so the amount that is subject to tax is based off of something called provisional income. So the IRS uses this to determine how much of your Social Security benefit is subject to income tax. And so what's your provisional income? It's your gross income plus 1/2 your Social Security benefit plus any tax-exempt interest. So it's all your income from other sources plus 1/2 your Social Security benefit plus any tax-exempt interest. And so I don't know how they come up with these things, but Essentially, what you need to know is if your income married filing jointly is over $44,000, up to 85% of your Social Security benefit is subject to tax. And so what that means is 15% of your Social Security is tax-free. The other 85% you have to pay tax on. For most retirees, you're paying 10 to 12% in tax. With Social Security, it's only subject to federal tax. It is not subject to state or local tax in Ohio, Kentucky, or Indiana. If you do live outside one of those states, I would encourage you to check your state's tax code. Some states tax a portion of it. Some states don't tax any of it. So double check that taxation. But the reason I bring this up is because when you apply for your Social Security benefit, the office does not always ask if you want to withhold anything for income tax. So make sure when you apply, you tell them, more than likely, yes, I would like to withhold something for federal income tax. And so you can pick between 7, 10, 12, or 22% for federal income tax withholding. And that will be deducted out of your Social Security check automatically, so that come next April, you don't end up owing Uncle Sam a bill. So make sure you withhold something for income tax. You can switch the amount that's being withheld at any time. It's a simple form you fill out. It's called a Form 1040. And essentially all you do is you fill it out, you check a box saying what you would like to withhold for tax, and then they'll make that change for you, so you can switch it at any time. And I did misspeak earlier. It's a Form W-4V. So Form W-4V is what you would use to withhold from your Social Security for tax. All right, so you figured out what strategy you want to use and how much you want to withhold for tax, and now you're ready to apply for your Social Security benefit. You have 3 ways of applying. You can either visit your local Social Security office. As far as I know, all the local offices are still closed, so unfortunately you cannot do this at this time. You can call and schedule a phone appointment. There's the 1-800 number. I would encourage you to call at 7 a.m. when the phone bank's open to avoid being on hold for an hour to an hour and a half. And when you do get a hold of someone, you're not actually filing for your benefit at that time. They're scheduling you a time, typically a month out, to file for your benefit, either at your local office or over the phone with a representative. Or 3, you can file for your benefits online. This is the easiest way to do it. It takes about 30 minutes. They'll ask you some questions, some pretty simple questions, and you'll hit submit. And then for whichever month you said to start up your Social Security benefit, you will start receiving a check the following month. And so one thing to note about this is you cannot file for a survivor benefit online. So you do have to still call your local Social Security office or visit your local Social Security office to file for a survivor benefit. At the end of this, when we send out our presentation, we will also include a PDF that does contain local office numbers for Ohio and Kentucky and Indiana as well. So it's important to note when planning for retirement when you will actually get your Social Security check. And so if you want to start your Social Security in April, you will not get your first check until May. So Social Security wants to make sure that you live a full month before they pay you any benefits. And so once again, if you file for April, you will not get your first check until May. And the day that your check comes is dependent upon the day you were born. So if you were born between the 1st and the 10th of the month, you will get your check the 2nd Wednesday of the following month you apply. If you were born the 11th through the 20th, you'll get your check the 3rd Wednesday. And if you were born the 21st through the 31st, you will get your check on the 4th Wednesday. Okay? So the earliest you can file for your Social Security is 3 months before you want to begin collecting. So 3 months before you want to begin collecting. So what you'll do is, say your full retirement age is April, and that's when you want to begin collecting. You'll apply, you'll submit your Social Security application 3 months before April, so that's January. So you'll submit your application January to say you want your benefits to start in April at your full retirement age, and you'll get your first check in May. All right, last slide here before we hand it off to Nate. So I meet with a lot of retirees, and I think the biggest question I get is, you know, Mike, how much money can I live off of in retirement without running out of money? And so this is the quick way of figuring this out. And so what you're going to do is you're going to add up all of your investment accounts. So 401ks, 403bs, IRAs, 457s, et cetera. Add them all up into one big pot. So we'll call it $1 million for easy math. So a typical conservative retiree portfolio should make roughly 4 to 5% per year. So the whole idea on your investment money is you want to make 4 to 5% per year, and you take 4 to 5% per year. So your account balance kind of stays the same throughout your life. And so if you have $1 million and you make, call it 5% per year on that money, that's $50,000 a year in investment income that you can live off of. You're going to take that number and you're going to divide it by 12 to get a monthly amount. So that's roughly, call it $4,500 per month that you can take from your investments. You're going to add that monthly investment amount to your monthly Social Security benefit, to any monthly pension benefits you might be receiving, and any monthly annuity checks you might be getting. And that's how much income you have coming into your household every single month. And so maybe take away 15% for tax or so, and that's how much money you'll have after tax, livable money to live off of per month in retirement. And so you want to make sure that when budgeting for retirement, that your budget is under the income that's coming into your household. And so, like I said, we help people figure out their retirement income all the time. So if you have any questions, we're always happy to sit down with you. There's my contact information should you have any questions. We really appreciate your time today. Like I said, at the end of the presentation, we will be taking questions, and we will send you a recap of the information and the slides presented in today's webinar. And so with that, I am going to hand the presentation off to Nate, our Medicare expert, and he will talk about what you need to know with Medicare.
All right. Thanks, Mike. Great job. Thanks for everybody for hanging on. And let me make this available so you can look at here. Okay. Okay. All right. Thank you so much for joining. I saw a lot of familiar names on the registration list, so thanks for joining again. I really appreciate it. And we'll jump right in here and get started. So on the Medicare side of HORAN, it's comprised of a few members of our team, is myself, Heather Ballou, and Chris Meehan, and we're what is considered an independent agent or an independent broker. So just to give you a little background before we get started. So what that means is that we contract with roughly 10 insurance companies. So when folks come to us and they need help figuring out what to do with Medicare and what plans to enroll in, we help shop all those plans and do the research and provide recommendations and actually help you get enrolled into the plan. And what's in it for us is that when we help people navigate all this and get enrolled into a plan, those insurance companies actually pay us a commission because we actually stepped in and helped you out. And the great part about all this is that there is no cost at all to you to get our help. So we don't have any fees. We're actually not even allowed charging any fees. And it doesn't impact the cost of your plan or the benefits. Literally, there's no cost at all to you. So we encourage you to reach out to us and with any questions you have. And, you know, Michael did a great job with his presentation, a lot of great information. I'm going to dump a lot of information on you today. So just keep in mind, this is a ton of information to get all at once. and we'll have copies of the presentation. This is currently being recorded, and it'll be on our website. So if anybody you know that missed it, or if you need a refresher, you can always come back to this and view it again. And we'll jump right in and get started, okay? So, navigating Medicare. All right, Medicare started in 1965, and it was designed for 3 groups of individuals. The first group is the group that we see the most often. It's those who qualify for Medicare based on their age. So you're first eligible for Medicare when you turn 65. You're actually eligible the first of your birth month. So whatever day your birthday falls in the month, say you're born April 23rd, you're able to start on Medicare April 1st. It always goes back up to the first of your birth month. I always get 1 or 2 in the crowd that happen to be born on the first of the month. You can actually start it a month earlier. So if you're born April 1st, you can actually start Medicare March 1st. That's the only scenario where you can start it earlier than your birth month. So that's the first group, those who qualify based on their age. The second group of individuals are those who qualify because they are on Social Security disability. This actually can be at any age. So we have some clients that are in their 40s and 50s that are on Medicare because they have been on Social Security for 2 years. Okay, so you have to be collecting, or you have to be on Social Security disability for 24 months. And then once you are on there, or on disability for 24 months, you're automatically enrolled in Medicare on your 25th month. Okay, so that's the second group. The third group, we don't see this too often, maybe once or twice a year, but this again is any age of folks who are diagnosed with end-stage renal disease, that's permanent kidney failure, and also Lou Gehrig's disease, ALS. A diagnosis of either of those, you qualify for Medicare. All right, so those are the 3 groups of individuals that qualify, and then Medicare has 4 parts, A, B, C, and D. And we're going to go over a little overview of each of those parts. But just so you know, the top 2 parts that you see, Part A and Part B, that is the government portion of Medicare. Okay, the government provides Part A and Part B. Every other part in Medicare, so Part C, Part D, there's another product called Medicare Supplement. Those parts are actually provided by insurance companies. So all the insurance companies, you know, if you're anywhere 65, you're getting bombarded right now in the mail with advertisements, and they're trying to sell you an Advantage plan or a supplement plan, drug plan. But that's how it's all set up. Government provides A and B, everything else private insurance company. And we'll get in a little more detail here in a moment. Okay, so there's a lot of rules in Medicare, a lot of rules, and when you do research on your own, sometimes it's confusing to try to figure out what those rules are, how they apply to you, and more importantly, what do you need to do. So there's a lot of myths about those rules, so I'm going to run you through some of the more common misconceptions that we hear about Medicare. Number one, a lot of folks believe that when you hit age 65, everyone just automatically gets Medicare. Now, that actually is true for some people. You'll actually hear me say that phrase a lot, that this is true for some people, but not everyone. So if you start collecting Social Security prior to age 65, so if you start collecting at 62, 63, 64, if you're collecting Social Security, you are actually automatically enrolled in Medicare. You'll be automatically enrolled when you hit age 65. Or, if you delay Social Security till 66 or 67, if you're not in Medicare at that point, you will be. So as soon as you start collecting Social Security, you're automatically enrolled in Medicare. Okay, so it is automatic for some folks, but not everyone. The second one, we actually don't hear this too often, but basically what this one says is that as long as you or your spouse, either one of you, have worked at least 10 years of your life paying Medicare taxes, there is no cost to Part A, and there's no penalty in delaying enrolling in Part A. Okay, so there's a few penalties that we'll talk about today, but this just talks about one of them. So as long as you pay Medicare taxes for 10 years or your spouse, don't need to worry about any penalty or cost with Part A. All right, out of all these myths, this next one's the most important. I hear it all day, every day. This is the most common one we hear. And the myth is that you have to sign up at age 65. Okay, so that is true for some people, but not everyone. All right, so here's how this one works. Medicare says that as long as you have health insurance coverage through an employer, and this counts for a spouse, so if you have a spouse on your plan or you're the spouse on the plan, the same rule applies to you. As long as you have coverage through an employer, and as long as that employer has 20 or more employees, then you don't have to sign up for Medicare at 65. Okay, so as long as you have coverage through an employer, 20 or more employees, you are not required to sign up. You are allowed to delay Medicare until you are ready to come off the plan. At retirement is typically what we see. And there is no penalty with delaying that enrollment. Okay, so as long as you have that coverage through your employer, you're fine. So, you know, I know a lot of people that are still working, they're reaching age 65, they're getting bombarded left and right about, you know, you need to enroll. You know, they're talking to friends and family, and they're all saying that you need to enroll. That is simply not the case. Okay, you are not required. Now, turning 65, that does count as a qualifying event. So that does allow you to come off of your employer plan. Whether that makes sense for you or not just depends on how much you're paying for your work plan. You know, what are the benefits? Sometimes folks are on a, you know, $5,000 deductible, and they hit it every other year or every year, and it's a burden, and they want better coverage. So that is an opportunity to move to Medicare if you wanted to, and that's where I and Chris and Heather, we do this all day long, and we help people figure out, you know, should you go on Medicare? Should you stay on your employer plan? What are the costs? What are the benefits? And we just, you know, weigh the two to figure out what's best for you. Okay. All right. Number 4, 3 and 4 are kind of related here, but I get this call every once in a while. The most recent one had a guy say that, you know, he's talking to his boss. He's turning 65, and he was told that he's not eligible for the employer coverage anymore. He has to go on Medicare. So there are age discrimination laws in the country that basically say, you know, if you are an active employee, if you're working a number of hours necessary to qualify for benefits at work, you're entitled to those benefits regardless of your age. So just because you get 65 doesn't mean you can't stay on your employer plan. You're certainly allowed to do that. All right. Number 5, this is last year or so has been the most common myth, I'd say, outside of the number 3 there, is health savings accounts. A lot of folks, a lot of employers are moving towards HSAs, and unfortunately, there's a lot of rules around that when it comes to Medicare. So the myth, you know, if you read this myth, the myth is that you can't contribute, you can't have an HSA after age 65. Okay? It's not whether you're 65 or older. That's not what Medicare looks at. They are wanting to know, are you enrolled in Medicare or not? As soon as you enroll in Medicare, you can no longer put money into your HSA. And your employer can't contribute into that HSA either. So if you're approaching age 65 and your plan is to keep on working, you're on an HSA plan through your employer, you want to keep putting money into that account, remember the rule is that you don't have to sign up for Medicare at 65 as long as you have that employer coverage. So we have plenty of people that are, you know, they don't sign up for any part of Medicare at all. That allows them to continue putting money into their HSA after age 65. So I know a lot of people are using the HSA money as like a little mini retirement account because the money goes in tax-free. Once you retire and go on Medicare, you can actually use the money that's in that account for various Medicare expenses. So we have a couple slides at the end that we're going to go over a little bit more in detail of HSAs. Okay, so those are the more common misconceptions and myths that we hear. All right. Moving on, now we're going to jump into these 4 parts of Medicare. First part here is Part A. Again, this is a part that's provided by the government. For most of the population, there is no monthly cost to Part A. And under Part A, that is all of your inpatient hospital-related medical expenses, skilled nursing facility, and hospice. So those claims roll up under Medicare Part A. One common misconception about Medicare is that it covers everything. So that's actually not true. Medicare does not cover all of your medical expenses. It covers a portion, and it leaves you responsible for a portion. Okay? So if you look under that bullet point that says, how are these services covered, the first bullet point underneath is if you get admitted into the hospital. Okay? So here's how it would work if you're admitted into the hospital and you have Medicare only. Okay? You just have Medicare, no other products. There is a deductible of $1,408. Okay? That is your responsibility. Medicare leaves you responsible for that $1,400 deductible, and they pay the rest of your hospital expense. So that's actually pretty good. I mean, $1,400 deductible is not bad. That is not bad at all. But the catch is on this is that is not a deductible that you're used to. Okay, it is not a calendar year deductible. It's not January through December deductible. It is what they call a benefit period, and it lasts 60 days. Okay, so what that means is that if you go into the hospital, you owe the deductible to $1,408. You get out of the hospital, if 60 days go by, and you happen to go into the hospital again, you'll owe another $1,408. Okay, so there's a potential there. I mean, if you have a rough year and you have, multiple trips to the hospital, there's a chance you might owe that deductible multiple times. And then, hopefully you're never in the hospital for 60 days in a row. But if you happen to hit that, then starting day 61, you're not only responsible for the $1,408 deductible from the first 60 days, but then now you have to start paying a $352 copay for each day that you're in there, starting at day 61. And at day 91, they double it to $704. So while Medicare does provide, some core benefits to you, it is very important that, we strongly suggest that, you don't have Medicare by itself. You want to have some type of product in addition to Medicare to help cover some of these expenses. And we'll talk about that here in the upcoming slides on what those options are, okay? So we'll move on to the next part of Medicare, Part B. So as you're planning retirement and you're trying to figure out how much is Medicare going to cost, this is the first dollar amount that you're going to write down, okay? So when you're trying to, if you're taking notes right now and you're trying to figure out a budget of Medicare, this is the first dollar amount, okay? The standard monthly premium of Part B is $144.60. That actually could be higher based on your income. So I won't go into the details about that, but basically they look at your income from 2 years ago, and then there's like 6 different income brackets. So depending on what your income is or was from 2 years ago, that'll determine how much you pay for Part B. But for today's purposes, we're just going to stick with the $144.60. All right. So if you remember back on Part A, that's all of your inpatient hospital-related medical expenses. Part B is all of your outpatient-related medical expenses. So there's a lot that rolls up under Part B. So that's doctor visits, your primary care doctor visits, specialist visit, any kind of outpatient rehab facility, medical equipment, ambulance. That all rolls up under Part B of Medicare. So just like Part A, Part B doesn't cover all of your medical expenses. It covers a portion, and then it leaves you responsible for a portion. Okay, so under Part B, here's how this works. You have a small yearly deductible. This one actually is a yearly deductible. The small deductible of $198. Okay, so you cover the first $198 of your outpatient medical expenses, so doctor visits and things like that. Once you hit that $198, then for the rest of the year, Medicare covers 80% of your expenses. You cover 20%. Now, covering 80% of your bills is a decent amount. I mean, it's a good chunk of percentage off of your expenses. The problem with this 20% is that there is no cap There's no limit to that 20%. So if you start thinking about all of these expenses that could potentially roll up under B, you're talking, maybe an ambulance ride or an outpatient surgery or chemotherapy, doctor visits and tests. You're paying 20% of those bills up to an unlimited amount. There is no cap. So you're risky. It's a little risky there to have Medicare by itself. So again, that's kind of the moral of the story with Medicare is that, while it does provide some base coverage, you definitely want to have some type of insurance product in addition to Medicare to help pick up what Medicare leaves you responsible for. So again, we're going to jump into those different types of products here very soon. All right, so that's A and B. That's the government portion of Medicare. Here's what a Medicare card looks like. So on the left-hand side, that's an old Medicare card. That Medicare claim number that you see that's all zeros, that used to be your Social Security number. That used to be on everyone's Medicare card. They've taken that off now, and they've replaced it with just, it's 11 characters, just random numbers and letters. Also removed your gender from there as well. When these new cards were being mailed out, there was a huge scam going on. People were getting phone calls stating that they were from Social Security and Medicare, and that in order to get a new Medicare card, they had to verify their identity. So people were giving out all of their contact information and personal information, name and address and Social Security number. And there was a lot of people getting scammed because of this. And we're seeing it now with coronavirus as well. So there's scammers calling people that say, in order to get your, you have to provide your personal information. We're seeing it on the healthcare side. In order to you can get a free coronavirus test kit mailed to you. Just give us your information. We'll send it out to you. That's false. There's a lot. Basically, any major events that happen in the world and Medicare and healthcare, you can almost guarantee there's a scam attached to it in some way. So just so you know, and spread the word here, that there is no government entity that will make outbound phone calls and then ask you for your personal information. They never do that. So, if you have any loved ones on Medicare, just kind of, make sure they're aware of that. It happens more often than it should. Okay, Medicare Roadmap. All right, so this is when I have a sit-down, like one-on-one session with folks, this is really the main document that we use to basically help illustrate to you what those options are once you are on Medicare. So at the top of this roadmap, you can see the government portion of Medicare is A and B. So as you're making this transition on to Medicare, that is step number one. Step number one in making any switch over to Medicare is that you have to apply for Medicare A and B first, okay? And you're allowed to apply for Medicare once you're within 90 days of when you need it to start, okay? So I have people now, that they didn't sign up at 65 because they had coverage through their employer. I have a handful of people that are trying to retire now at July 1st. So 90 days prior to July 1st was April 1st. So as soon as April 1st hit, that's when they were first eligible to kind of start this process of applying for Medicare. So keep that in mind. 90 days prior to when you're going to lose your employer coverage, that's when you start the process of applying for Medicare. And also remember the cost that we just talked about. So Part A, there is no monthly cost. Part B is $144 a month. It doesn't matter what insurance plan you pick. You're always going to have that $144 a month. Okay, so keep that in mind as you're trying to figure out your monthly budget on Medicare. Okay, so you have two options here. You have Medicare Advantage. That they also refer to that as Part C of Medicare. We refer it to as Medicare Advantage. And then Medicare Supplement. You'll also hear the term Medigap. The Medicare Supplement, Medigap, same thing. We like to use the term Medicare Supplement. So those are your two main options, Supplement and Advantage. Okay, so on the left-hand side here, Medicare Advantage. I'm going to through basically this next slide here on kind of what are the pros and cons to an Advantage plan, how is it set up. So on an Advantage plan, what's really attractive about an Advantage plan is the monthly cost. So that's the main reason why folks who decide to go with the Medicare Advantage plan, that's the main reason why they want one of those plans, is because of the low monthly cost. Most of those plans are actually $0 per month. You actually don't have to pay anything extra, no monthly payment, to have an Advantage plan. However, you do pay for your medical expenses, and you usually pay for them in the form of a copay. So when you go to the doctor, there's a copay. If you go to the emergency room, there's a copay. If they run any tests on you, there's a copay on those tests. If you get admitted in the hospital, there's a copay for every day that you're in the hospital. Everything has a price tag on it, basically. So you are paying out of your pocket every time you have medical care. And very similar to employer plans, like on your employer plan now, there's a what they call your out-of-pocket maximum. There's a limit to how much you have to spend in medical expenses in a year. And if you hit that maximum, then that's when you're covered 100% for the rest of the year. That's how these Advantage plans work as well. You keep paying your copays for your medical care until you reach the maximum. Most maximums on these plans range somewhere between $4,000 and $6,000. Most of them are right around $5,000. So you keep paying your copays, and if those ever add up to $5,000, that's when they start covering everything 100%. Okay, so just a little recap. No monthly payment. You pay copays for all medical expenses. If you ever hit the maximum, usually around $5,000, then you're covered 100%. Part D of Medicare, D as in dog, Part D of Medicare is the drug coverage of Medicare. It's automatically included in these Advantage plans at no additional cost. So you have copays for doctor, for hospital, for pharmacy, basically all wrapped up into one plan for no monthly payment. Now, these Medicare Advantage plans actually replace Medicare. So when you go see the doctor, you go to the hospital, pharmacy, you're not showing them your Medicare card. You're just showing them your Medicare Advantage card. And you're going to get these Advantage plans through some type of insurance company. So whatever insurance company you have, Anthem or Humana, United Healthcare, Medical Mutual, Cigna, all those insurance companies that you know very well, you have to stay in that insurance company's network. Okay, so that's an important aspect of these Advantage plans that you need to know, and that's what we help people figure out. When you reach out to us, we'll ask you for a list of your doctors and hospitals that are really important to you, because if you're interested in an Advantage plan, we do help you do the research and figure out which insurance companies have your doctor hospitals in the network. Okay, we don't want to get enrolled into a plan and all of your doctors are out of network. So we help you figure that out. Okay, so that's basically a crash course in an Advantage plan. Okay, so let's go back to the roadmap. So on the right-hand side is your Medicare Supplement option. You can see here, you'll have to see a little blue plus sign here. There's a plus sign for Part D. So your Medicare Supplement plan is just for your medical benefits. Then you have to purchase a separate Part D drug plan. So they split up your medical and your drug coverage into two separate plans. Okay, so let's talk about your supplement plan. Okay, so there's 10 of them to choose from, and we're not going to go over all 10, but I'll tell you one specifically that is basically the most common Medicare supplement plan that people purchase. It's called Plan G. G is in giraffe. So Plan G, it covers 100% of your medical expenses after you meet the Part B deductible. So remember back on when we went over Part B that there was a deductible of $198. So when you have a supplement plan, you cover the first $198 of your medical expenses. After that, the supplement plan picks up all medical expenses 100%. So, if you think about Part A, when we went over that deductible, that $1,400 deductible, that 20% that you have to pay when you're on Part B, that supplement plan picks all that up 100%. You are only responsible for $198 deductible for the whole year. Now, there is a monthly cost to that, okay? So for someone turning 65, The cost on a supplement plan right now is right around $110 a month, 110, 115, around there. Okay, and that, again, that's in addition to what you're paying Medicare. So that's the trade-off here. So higher monthly payment, but lower out-of-pocket in medical expenses. Now, these supplement plans do not replace Medicare like the Advantage plans do. The supplement plans, the name kind of says what it does. It supplements Medicare. So Medicare is considered your primary insurance. The supplement plan is your secondary. So what that means is that whatever insurance company you pick on the supplement plan, you don't have to stay in that insurance company's network. The network is actually just Medicare. So you can see any doctor in any hospital in the entire United States. As long as that provider accepts Medicare, then your supplement plan will cover the expense. We have a lot of retirees that, you know, they have a bucket list of places they want to go to and travel. And, you know, if you're on a supplement plan, you don't really have to worry about, you know, something happened to you while you're traveling. The Advantage plans, you know, there is a network, and you have to be kind of careful there with out-of-network benefits. Okay, so no networks. You know, go to anyone in Medicare, but again, you have to purchase a separate drug plan. So on the right-hand side of the screen here, you'll see a separate drug plan. There's quite a few to choose from. There's like 26 different drug plans. The average cost of a drug plan is right around $20 a month. Some plans cost a little less, some are a little more, but right around $20 a month for a drug plan. So we'll also, you know, if you reach out to us and need help, we not only get a list of, you know, what doctors are important to you, but we'll also ask you, what medications do you take? All these drug plans cover medications in a different way, so we help you research those drug plans and try to find the one that best covers your particular list of medications. Okay, so those are your two main options, Advantage and Supplement. Now, here's a very important rule that you need to know about all this, okay? So if you are taking notes, here's an important note to take down. When you first enroll in Part B of Medicare, you have a 6-month window where you can enroll into any supplement plan through any company that you want, and it's guaranteed, meaning you do not have to answer any health questions. It doesn't matter if you're healthy, if you're sick. You get a guaranteed enrollment into that supplement plan when you first sign up for Part B of Medicare. Once that 6-month window is gone, if you want to enroll into a supplement plan after that, now you do have to qualify based on your health. Okay, so I've seen people that were not aware of this rule, and it is challenging sometimes to kind of walk people through this. But basically, like, for example, like if you start with an Advantage plan and then a year or two goes by and then you want to switch over to a supplement plan, you can. However, now you have to be basically healthy enough to make that switch. These insurance companies are going to ask you, have you had a heart attack or stroke or cancer? And if you've had anything major in your recent health history, they can choose to deny your switch, and you have to stay on your Advantage. Switching from Advantage over to Supplement requires that health history review. Now, when you're on an Advantage plan, if you want to switch to a different Advantage plan, there is no medical history review. So that open enrollment period that you see at the bottom of that column there, October 15th through December 7th, that is Medicare open enrollment. You can switch from one Advantage to another. That's no problem at all. But again, switching from Advantage to Supplement requires that medical review. You got to be healthy enough to do that. Now, if you're on a supplement plan and then you want to move back to an Advantage, not a problem. Not a problem. You can do that during the open enrollment period. They do not evaluate your health from Supplement to Advantage. But just going back to a supplement plan, got to be healthy enough to do it. So the one and only time you get it guaranteed is when you first enroll in Medicare Part B. All right? I know we're flying along here, but I'm going to skip ahead a couple slides here. That's just a grid of the various supplement plans that you get to choose from. The most commonly purchased, again, is Plan G. Plan N is also highlighted there. Those are basically the top two options that like 98% of the people fall into either G or N. So those are your main options there. Okay. Now we're going to talk about, I know we only got about 10 minutes left, so we'll go through this a little quickly here, but we only got a few more slides to go. But this particular slide is referring to the prescription coverage of Medicare, okay? The term donut hole, have you heard the term donut hole before? That refers to the prescription coverage of Medicare. So this is by far the most complicated part of Medicare, in my opinion. So bear with me as I walk you through this. But every drug plan in Medicare has to follow this structure that you're looking at. And this is going to apply to you whether you enroll into an Advantage plan or you enroll into a supplement, and then you got your separate Part D drug plan. This structure applies to all Medicare prescription plans, okay? So there's basically 4 stages of prescription coverage. Your first stage is the deductible stage. The Medicare says the standard deductible is $435. Not every plan has a deductible, so you might have one. You might not have a deductible. It might not be $435. It might be less. So, but once you get through this stage, or if you don't have a deductible, then you go into the next stage called the initial coverage period. When you're in this period, all this means is that when you go to the pharmacy, you're going to pay some type of copay for your medication. So, you pay $5 for this medication, $20 for this one, and then your insurance company picks up the rest. Now, what happens in this stage is that your insurance company every month is going to send you a letter that says, that basically gives you a summary of what the medication that you filled the last month. So they're going to say, okay, last month you filled this medication, you paid $5 for this one, you paid $20 for this one. Your insurance company picked up, $10 on your one medication and picked up $30 on your other medication. And they're adding together what you're spending and the insurance company is spending, and they're coming up with a grand total of prescription expenses for the year. If that grand total for the year ever reaches $4,020, you are now out of the initial coverage period stage, and now you've entered into the coverage gap, also known as the donut hole. Once you're in that stage, now you no longer have copays for your medications. Now you're paying a percentage of the cost of your medications. Now it's 25% of the cost of the medications, okay? So now you're paying 25% of the medications. If you go from where you were, the $4,020, and then if you end up going up to $6,350, so it's not an additional $6,350, it's going from the $4,000 up to $6,350, so another $2,300. If you ever hit that $6,350 amount, then you're out of the donut hole, and now you hit the final stage at the bottom where they call it catastrophic coverage. You will not pay any more than 5% of your medication. Crazy, right? Kind of a wild structure here, but everyone's situation, everyone's experience in this is completely different. I have some people that, most people actually don't hit the donut hole, but I have some people that don't hit the donut hole. I have some people that they're in the initial coverage period for a few months, the donut hole for a few months, and then the final stage for a few months. Some people that'll blow through this whole thing in 3 or 4 months. So your experience in this has everything to do with how many medications you're taking, how expensive they are. That'll kind of determine what your experience is in Medicare. Okay. All right. A few more slides to go. Penalties. Okay, there are 2 main penalties in Medicare, the Part B penalty and the Part D penalty. Part B penalty is not up here because it's basically what I've already mentioned at the beginning, is that as long as you have health coverage through an employer or your spouse's employer, as long as that company has 20 or more employees, you will not be penalized on Part B of Medicare. Okay? You're allowed to delay enrolling in Medicare until you're ready to retire. Part D, however, goes one step further, and it says that even though you have health coverage through your employer, that coverage that you have has to be good enough according to Medicare. It has to meet Medicare standards. The term that they use is called creditable. So if you're on an employer plan and you are considering whether to delay enrolling in Medicare or not, you have to ask your someone in HR, or you have to ask someone at your employer, is my plan creditable? If it is, then you're fine. You will not be hit with any Part D penalty. But if it's not, there is a penalty that comes along with keeping your employer plan. Okay, so creditable. If it's non-creditable, there is a penalty. So we only got a few minutes left, so I'm not going to dive into the calculations of the penalty. But if you happen to be on a non-creditable health plan, reach out to me, let me know, and I'll walk you through some strategies to avoid getting hit with that penalty. Okay. 2 more slides to go. HSAs. So we kind of touched upon this a little bit at the beginning, but just so you know, as soon as you enroll in Social Security, you're automatically enrolled in Medicare, which means that as soon as you enroll in Medicare, you can no longer put money into your HSA, and your employer can either. Okay, so that's very important as you're considering whether, the timing of drawing Social Security and when you should do it. If you're on an HSA, you got to be a little careful there with when you do that. So there's the limits in the blue box in the middle. The most an employer can put in, the most you and an employer can put in as an individual is $3,550, family $7,100. The bottom bullet point is an interesting bullet point. Remember what I'm talking about, that if you enroll in Medicare, and as soon as you do that, you can no longer put money into your HSA. That rule is only for the employee. That is not for a spouse. So if you have a spouse that starts taking Social Security, or they're enrolled in Medicare, and they're on your health plan, the fact that they're enrolled in Medicare has no bearing on your HSA. Okay? It's you as the employee. Okay? They only care about the employee status of Medicare, not your spouse. Okay. Now, you retired, you have money sitting in your HSA. What can you do with it? You're allowed to use that money to help pay your premiums. So your Medicare Part B premium, that $144.60, the drug plan premium. Basically, you can use that money for all medical expenses and premiums, except for your Medicare Supplement premium. I don't know why you can't use that money for your supplement premium. Everything else you can. All right. Here's the last goofy rule that you need to know about Medicare, and then we're done. All right. If you delay enrolling in Medicare until a later date, so let's say you're trying to retire now at 68 and you're now enrolling in Medicare, when you sign up for Medicare, they're actually going to retroactively start Part A back 6 months. This was intended as a benefit, as they will retroactively cover any hospital-related expenses going back 6 months. However, remember, the rule is you can't put money in your HSA once you're enrolled in Medicare. So what does that mean? That means you have to stop putting money into your HSA 6 months before you plan on signing up for Medicare. Okay? So, I got a few more things to say on that, but we're coming short on time. But basically, as you're planning retirement and you're trying to figure out the timing of certain things and what you should do, reach out to us. We'll walk you through the timeline of events, what you need to do, forms you need, and things to be aware of. When you look at this last slide, there's a lot of resources here. On the top left, you have my contact information. You also have my colleague, Heather Ballou. So she also specializes in not only Medicare, but also under 65. So if you are not yet 65 and you need help navigating the marketplace and individual health plans, I can do that. Heather can do that as well. And that's it. That was an hour and a half of just a ton of information. So I really appreciate you all joining. We'll open we'll see if there's any questions left in the Q&A here, and we'll answer those. And then again, we'll have a copy of the presentation, and we'll also have a recording and a link put on our website. And then those who would join for CE certificates, those will be emailed after this is done as well. Okay, so let's stop sharing this, and see if we have any questions to answer. All right, let's see. All right. It's like, I think, Michael, did you answer? I don't know. If someone's talking, it's muted. Let's see here. All right. Well, I'll answer these questions. Send me an email or give me a call, and we'll get all of your questions answered. But again, there will be a link we'll share with you. We'll also have it on the HORAN homepage as well once we get this completed. But thank you very much for joining, and have a great rest of your day.